Hi, Mary Gavoni here. It's August 19th, 2020. Our topic today is how to deal with the shortage of surface disinfectants in dentistry. Many of you have heard from your dental supply reps that disinfecting wipes are in very short supply and you don't know when you're going to be able to get new shipments of them. And of course, that's such an intricate part of patient care because we always do a good job of cleaning and disinfecting after every patient. So what do we do and what shouldn't we do? Well, the thing that you absolutely should not do is soak your disinfectant in gauze or soak gauze in your disinfecting solution. The reason that you shouldn't do it is twofold. The first is that that's an off-label use of the product. In other words, the EPA approval process for that product is that it be used in the manner in which it's sold to you. In other words, a spray bottle or as a disinfectant wipe. It is not sold to be used as a soaking agent on gauze or some other types of materials. So the other thing that you need to know about that is that there are studies that show that the fibers in the gauze will bind up the active ingredients from your product within about 24 hours and render it ineffective. So in other words, it's useless. You've just got wet gauze and it doesn't have any disinfecting properties. So some people are religious and really good about making up fresh gauze and solution every single day, but there will be times I'm sure that gets forgotten and we just go ahead and use it again. How bad can it be? So I don't recommend soaking. I think it's just too risky of a procedure. Now, some of you are questioning why is the gauze not good and we can get disinfecting wipes pre-saturated, why doesn't that inactivate the solution? And the difference is the type of fiber in the product and also in the processing of the product. There may be bleach or other chemicals used in processing the gauze that also can render the disinfectant ineffective, which is different from the wipe materials. And again, the wipe materials are proven to be effective that way through the EPA. So what do you do then? You could go back to the old spray wipe spray technique. You spray a surface, you wipe it to clean it, and you spray it again, leave it in contact with the surface for the appropriate contact time. But what we found over the years is that with so many people in a practice spraying disinfectants all day long that many team members developed respiratory problems, in particular what is called allergic or allergy-induced or work-related asthma from exposure to those chemicals that we did transition over to using wipes. Now, you can take a gauze or a paper towel, whatever you're using to apply your surface disinfectant, and spray the solution directly at that gauze instead of dispersing it into the air. That's one way to apply it. Another way is to purchase very inexpensive squirt tops that you can put on a disinfectant spray bottle. Biotrol makes them. They're available through your dental supplier. They cost about $1.70 a piece, and they let out just enough solution to saturate the gauze without pouring out the whole bottle of solution or wasting solution. They're really, really great little dispensers called squirt caps, and they'll fit on any disinfectant spray bottle. You also can buy dry wipes through your dental supplier, and then you can saturate those dry wipes with solution. So there's some good options for you to deal with the shortage of disinfectant wipes. Now, I also would caution you from reverting to using bleach as a disinfectant. Keep in mind that bleach can be corrosive, it can be damaging to equipment, plus you may get a buildup of chlorine fumes in your facility, which is not a good thing from a health standpoint for the dental team. And please do not take advantage of or try out some of the recipes that you may see online for making up your own solutions with essential oils or other products. If these products are not EPA registered as a hospital grade disinfectant, they should not be used in conjunction with patient care. So hopefully that addresses some options for you, things you should or shouldn't do in terms of disinfecting and cleaning surfaces. One other thing I just want to mention is that some practices have been using aerosol spray products for disinfecting. Keep in mind that an aerosol spray product is sold as a disinfectant. It is typically not a cleaner disinfectant. So you would need to use a different product to clean surfaces first before you would spray it. But again, an aerosol product causes the same issues that we may have from using a liquid spray from a spray bottle. Respiratory issues for the team. The other thing I want to mention too is that if you're going to change products, because I can't get my preferred product and I'm going to switch to another one that is available to me through my dental supplier, make sure that you clean your surfaces first. In other words, you need to take a hot soapy solution. I recommend using Dawn dishwashing liquid and go over all the surfaces to remove any buildup or residue of your previously used product, because if it interacts with the chemistry of the new product you start to use, you may get some staining, discoloration, or some bad odors in your treatment rooms. So if you're switching chemistries, then make sure you clean all of your surfaces first. So thanks for watching. If you have any questions, you can send them to me at mary@marygavoni.com. I'll be happy to answer those as quickly as I can for you. If you'd like to be able to get access to more of these videos, please subscribe to our YouTube channel while you're here. And if you'd like to receive our monthly compliance newsletter, which addresses OSHA and HIPAA compliance issues, please go to our website, marygavoni.com, and sign up. It's complimentary. Stay safe, stay well. Thanks for listening.